Please always consult with your physicians prior to making any changes to your treatment plan. Music is courtesy of Ryan Hamner. Welcome to Living with Scanxiety, the Cancer Podcast, a podcast geared to help you navigate the pediatric cancer world. As a mother of a child who battled a soft tissue sarcoma for over a year, your host, Rosaria Kozar, understands and will help guide you through your journey. She brings the knowledge of experts, families, survivors, and other organizations tied to the pediatric cancer world to your doorstep. Her mission is to inform, support, and promote hope for you and your family.
This is where hope lives. This is where hope thrives. Together as one, we all laugh and we cry.
Picture of what happens with trauma, this idea that our body is overwhelmed. And I think you bring up such an important point of this idea of like, this is not who you are. And I think when your whole life changes and everything that used to remind you who you are changes, so like for kids, not going to school anymore, not playing with friends anymore, not being at home anymore some of the time. And for parents, kind of the same thing, not really going to work, not being able to go places and see friends. It's really easy to lose contact with the things that remind you who you are.
Hi, this is Rosaria Kozar, and I'm here with Alexandra Neenan, and she is in her third year out of 5 at Eastern Michigan University. She is currently studying clinical psychology, and she's getting her doctorate with a specialty in pediatric oncology. She volunteered with Alex's Lemonade Stand, and that's really what turned her onto this path of pediatric oncology. And we all love Alex's Lemonade Stand. You guys are fantastic. But more importantly, today's topic and what I'm going to be discussing with her, or rather she's going to be telling us about, is the aspects of mental health. And there are so many aspects, but we're going to focus on different ones that you might not have heard before. So make sure you tune in for the entire episode because they're very important for all caregivers. And we've heard about flight, fight, or freeze, and we've heard about post-traumatic growth. And there are some things that we haven't talked about, and I really want to get involved with her on these topics. So on that note, welcome, Alexandra.
Hi, thank you so much for having me. And thank you for that introduction, Rosaria. It's really great to be here.
Oh, it's great to have you. And I just want to hear more about what interests you the most.
I think for me, it's kind of summed up by a paper that I was reading recently. And the title of it was basically like, is this community, like parents, kids, I think it was parents in the paper, but it was like, are they at risk or resilient? And then reading more into the paper, the answer was really like, they're both, right? Like pediatric cancer is such a difficult journey. For some people, they may be in treatment. For others, it may be the survivorship journey or the bereavement journey. There's kind of so many pieces to it. And it's really easy to kind of get caught up in like, are we like mentally healthy, mentally ill? And it's way more complicated than that. A lot of these issues can really coexist. And I think that's a lot of what we can talk about today.
Definitely. So when we say coexist, we're talking about as a social work student and as a future PhD, we call them comorbid. So you can have one thing like post-traumatic stress disorder, and then it would be comorbid with maybe major depressive disorder or any other type of mental health diagnoses. So that's the wording that we use. So if you hear us use that. So when your child was first diagnosed, we have a sense of the flight, fight, or freeze. And then we go into the anticipatory grief. And for me, that was literally a pit in my stomach. I just was staring at my son. And then a friend walked in the door whose grandson had just been diagnosed and took me by the shoulders and literally like shook me. And it took me a minute to come out of it. And because I was just frozen. And she said, see that boy. And she's talking about my son, Brody. He is alive. He is over there playing. You need to be there through this entire time with him. So what is that called? And why do we have that feeling?
Right. That like anticipatory grief that you just described that can kind of take over. It's a really natural response because when you get that diagnosis, right, when you hear those words, your child has cancer, particularly as a parent, you're aware of all the different possibilities. And our bodies are really kind of prepared to fend us off from threats, right? Like that's where that fight, flight, or freeze comes from, is a long, long time ago, most of the threats that people would come across were things that were physical, right? Were things that you could run away from. And unfortunately, certainly with cancer, that's just not possible. And so our body kind of breaks down on us a little bit. And with that grief response, there's this understanding of not only this is my child who I could lose, but also this is my life. Everything that I was doing, everything that I was living before is now gone. And so you have these like kind of multi-layered griefs on top of one another. And yet kind of like you mentioned, your child is still there in front of you in that moment, right? And I know for a lot of families, no matter like what the prognosis is, whether there's the expectation that the child will survive treatment and beyond, or with some of the really difficult diagnoses, I think of things like DIPG, where parents are basically told like from the very beginning, your child is probably not going to survive. Regardless of what that is, there's kind of this recognition of like death is possible. And that more than likely just was not on the table before.
Mm-hmm. Absolutely. And that's why I think she had to literally shake me out of it. I was just stuck, and I was stuck in that anticipatory grief. And I think if I couldn't identify with her and her with me, because she was the grandmother of a son that was just diagnosed, who is 100% healthy right now. So I am very excited to let you know about that. But nevertheless, if I didn't have her there, I think I would have been stuck in that stage for much longer, because we kind of built our own community together because we were next door neighbors. But yes, definitely. Everything you're saying is true. And I see it last in some parents longer than others, which kind of leads me to the next thing. One of the first things as diagnosis goes is you have some chemo. This was my experience. You have some chemo. It makes the tumor smaller. Then they go in and they remove it. When they go in to remove the tumor, and I'm not sure how this goes for leukemia because it's a blood cancer, you usually get a pamphlet or the doctor asks you, do you want to donate the tumor? So at that point, what are we talking about?
Right. So thinking about that experience, right? You've kind of been through this horrible, horrible thing that nobody should ever go through. And one of the amazing things to me about so many families who go through this is often very quickly, they find themselves experiencing this very strong desire to help others. And of course, something like tumor donation, where it's essentially a part of the child's body, it's cells that grew in them, that can have a lot of significant meanings. It's something that can vary across cultures of whether that's something that you'd want to sort of keep to the family or give away, if you will. But for many families, it does kind of offer this opportunity to give back in a way, right? To give back to the research that's hopefully going to make things better for the next child. And one of the things that just inspires me so much is knowing how dedicated many, many families are to that journey and to that hope that things are going to be better someday.
Mm-hmm. Definitely. And should parents be concerned that they are going to regret their decision? If you have any research on that?
Definitely none on regret that comes to mind. One of the only studies that I personally have come across in terms of tumor donation is just interviews that have been done with parents about why they donated the tumor. And overwhelmingly, it is because of that motivation to help someone else. And oftentimes when we have a really clear identified value like that, that's driving our behavior, we're a little bit less likely to really, truly, deeply regret the decisions that we make. There may be things that come up over time, some difficult emotions, but just more broadly, when we're acting in ways and we know why we're doing it and it's fulfilling like a really deep purpose for us, that's often really satisfying, right? I think we can all think of examples of that in our own lives.
Mm-hmm. And what about people that almost feel guilty that they didn't do it? What do you suggest?
That's so tricky because it's that really difficult balance of wanting to help other people, but also having to kind of put your own needs first, right? And that's, as someone who's going into this clinical psychology field, who wants to work with families to address all these conflicting feelings, one of the things that's pretty close to the top of my list is that everything that families do, to the greatest extent possible, should feel empowering to them. Because I know that like in our culture, there's often a lot of pressure on families to sort of have this like warrior role or like fighter role, like be inspiring to other people. And yet at the same time, they're in this position of needing a lot of help, which can be really hard to accept. And so the last thing that I want to do is to put even more pressure on families to feel like there is basically the right way to go through a situation that's just wrong.
Mm-hmm. Absolutely. And just to turn the tides here, in terms of talking about trauma and comorbid diseases, what would you suggest is the most common thing that caregivers and or patients come out with?
Sure. I know I have a post about this relating to parents. The big three that we see in terms of like diagnostic groups or like symptom groups is depression, anxiety, and that post-traumatic stress. So particularly with the post-traumatic stress, which is kind of like that overactive fight or flight response and a lot of the intrusive memories that people may experience, that is super common in the first few weeks after diagnosis. Thinking more long-term though, feeling depressed, which is more than just being sad. It's also exhaustion, difficulty concentrating, a sense of guilt and hopelessness. That's one kind of cluster of symptoms that's pretty common. Also anxiety, so being really tense, being really on edge, having thoughts that you just can't get out of your mind, right? That worry that something bad is going to happen. That's kind of another cluster of symptoms as well. And some parents may find that they have a lot of symptoms of one of these clusters, in which case, if they were to work with a therapist or a social worker, they may find that the most appropriate way to think about that is like a diagnosis of a particular disorder. That being said, especially in the context of pediatric cancer, many parents, many children, many siblings too, experience difficulties that are challenging, that make things difficult, but aren't necessarily on the level where we would say, you meet criteria for this diagnosis at this time. And I think that is something that is a little bit more complicated. It's something that's harder to describe when I think about just sort of communicating like through Instagram or just in that like public way. This idea that we could have symptoms of something, but not necessarily have like the full diagnosis. And it's not to say that people don't need support, but rather thinking about, is it going to be most effective to spend a significant amount of time working one-on-one with a therapist to really work through some of these issues that are making day-to-day life unbearable? Or is it that maybe you're in a place where working with family members or working with a social worker to identify like, how can we maybe reduce some of the stressors in day-to-day life, or seek support from friends, or do some of these things where there are some symptoms present, but they're not totally taking over your life? And some people may find that it's a combination of the two that are needed, that there are these symptoms that are getting in the way of life, where working with a therapist specifically on the symptoms could be helpful, and getting some assistance to kind of activate the social support is also going to be beneficial.
Absolutely. And one of the things as a future social worker that I found in my diagnostic class was PTSD is it has a lot of dynamics to it. So it's not just, oh, I see something, it reminds me of something, or I smell something, it reminds me of something. But it can actually trigger anger, and it can actually trigger quick anger. So quick responses. Something might just happen and flip your switch where you're just not your typical self and not having your typical control. And I think people need to realize that these are symptoms. They're not who you are as a person. Can you tell me more about that?
Absolutely. Our understanding of trauma is something that is evolving day by day. But I think one of the things that really sort of sets trauma apart is the flashbacks. It's like you're suddenly back in the worst moments of your life, or at the very least that you're feeling the way that you felt during those moments, right? That really quick anger. It's another example of like that fight or flight, which we sometimes hear about it in anxiety. It's also a pretty good picture of what happens with trauma. This idea that our body is overwhelmed. And I think you bring up such an important point of this idea of like, this is not who you are. And I think when your whole life changes and everything that used to remind you who you are changes. So like for kids, not going to school anymore, not playing with friends anymore, not being at home anymore some of the time. And for parents, kind of the same thing, not really going to work, not being able to go places and see friends. It's really easy to lose contact with the things that remind you who you are. And it becomes, unfortunately, very easy to get extremely overwhelmed by these emotions and by these symptoms, especially if you don't know, like, this is something that people go through when they have experiences like this.
Yeah, absolutely. And something that triggered me, I didn't get angry, but I totally was not ready for it. And one of my really good friends has a son that was friends with Brody. And he just happened to say something super innocent. And that was, Brody's in heaven and he's a little kid. And I just was not ready for that. And it just came out of nowhere. And I had to do everything to not cry, so much so that I felt like I was going to puke. And then I'm like, oh, this is all going on. This is wrong. Oh my gosh. And then I took a deep breath. And as someone that's going to become a clinician, realized, okay, this is all part of PTSD. I'm going to be okay. I'm going to be okay. Because it's stuff like that that happens too, that you're really not ready for. And it just, you have no control over it.
Yeah, that lack of control is such a difficult piece because it's kind of what makes the difference between these flashbacks or these emotional bursts being something that happens occasionally versus now this is something that's on my mind a lot because I can't predict when it's going to happen. Right. And that aspect of it, we call it like hypervigilance, sort of just constantly being on the alert for things that might bring on these traumatic responses because it's overwhelming, right? And it's this sense of, I can't handle having a trauma response, so I have to be looking out for everything in my environment to make sure that that doesn't happen. And it's exhausting, right? I imagine, if that's something that's familiar to you, if that's something that's familiar to anyone listening, it really kind of kicks up the burden of these symptoms because it's not just occasional. It's sometimes it happens and the rest of the time it's impossible to stop worrying about it. And that's a very, very common thing, especially when we're thinking about something like cancer, where it's very medical and it's this long-term treatment. There will be reminders of it for probably the rest of their life, even for someone who goes through treatment and maybe doesn't have a lot of side effects. That's sort of like ideal scenario. You're still looking at having to go to the hospital for scans and for follow-up care. And so those reminders and being very alert towards those reminders can be a really, really big challenge.
I have one question in relationship to that, because in a lot of therapeutic situations, they'll ask you to have and this might be kind of difficult to answer because this is completely unscripted, guys. So if you were to give a parent a daily affirmation that they could say to them, or a caregiver, that they could say to themselves every day to kind of calm aspects of, well, you can explain what a daily affirmation is. And if you could give one, that would be fantastic. Because that's never been done on this show. So I would love to hear.
Right. I think that is an incredible question. And it is one that is so personalized that, to be honest, I will kind of hold back from offering specifics. But I love that you asked it because I think it brings up a great example of something that someone could work on with a therapist. I think so often therapy seems very mysterious, and it can also feel like I don't need a therapist. There's nothing wrong with me. That is true. There is nothing wrong with anyone going through any kind of experience. And it's that sort of personalized care that a therapist can really dial in and help with. At the same time, though, I think everyone is entitled to education about what trauma is, right? That's one of the many pieces that I try to address on my page. I know on a couple of occasions, I've even just shared, so here's what PTSD is, kind of breaking it down a little bit, kind of like I did here, but in that written form, because I do think that for many people, just being able to understand, oh, that's what this is, I can relate to this, can be very empowering to start the wheels turning of thinking about how to kind of come back down in those moments when things get really heightened. Definitely not the case for everyone, but I think it's a starting point that is simple enough and accessible enough that we should be making sure that everyone has this information.
Mm. And can you just describe what daily affirmation is? So if they are in therapy, maybe they could ask for one if they're not already given one.
Mm-hmm. For sure. Thinking about some of the things I see on Instagram, one of the ones that I love that's so simple is just I am enough, right? And I think that's something that's broad enough that people could relate to it for a variety of different reasons. But it's this idea of just a word or a phrase that someone can say to themselves whether it's like when you wake up in the morning to kind of remind yourself of the things that you want to encourage yourself with, or it's something that you can say to yourself when things are really, really hard. Because certainly the more that something is rehearsed, the more it kind of becomes muscle memory, and the easier it is to access during those moments when we are really not okay.
Mm-hmm. A lot of therapy utilizes this, and they'll give you, 2 or 3 things. And if your therapist gives you something that's way too long for you to remember, let them know, because you are in charge in these sessions. They're to guide you, to help you. But if there are things that you literally don't understand, they're not going to help you. So that's not going to help you. So make sure daily affirmation is simple, is understandable, and something that you can just remember.
For sure. I think those are such great points. And I know for myself, like I am still in that training stage. So like all the therapy that I do is supervised by someone that's licensed. But even still with my own therapy clients, at the beginning of when we start meeting together, throughout therapy, just kind of intermittently, I'm always very clear. Like if I say something that doesn't sit right with you, that doesn't reflect your experience, that doesn't make sense, please tell me. And to the extent possible, I'll monitor like facial expressions or body language. And if I kind of get a sense like I could have explained that better, then I will, and I'll try again. For me, I kind of just view that as my job. And so for anyone out there who's listening, who's kind of wondering what it would be like to work with a therapist, those are certainly things that I hope anybody would get out of a relationship with their therapist. It's a privilege to be let into people's lives and to be trusted with the pain and the joy. And there really should be some humility with that. And I will say I've been incredibly grateful to work with supervisors and to work with other clinicians who have that mindset. And I like to believe that most therapists out there do. At the same time, it's important for everyone to be their own best advocate and to recognize what they deserve.
And I absolutely think you're on target with that. And I want to definitely add to that. If you walk in and in that first meeting, you do not click, don't go back. Just find somebody else. It's not like you are stuck with an individual that you go to and you're forced to stay with them. No one's forcing you to do anything. Find someone that you feel comfortable with and confident in working with, because if you don't, you're not going to get the help that you need. And a therapist isn't there to fix you. They're there to help guide you on your path towards wherever direction you need to go. So don't look at it as, this person, I have to tell them my life story and they're going to think that they know more than me. No, we're just there to support you and guide you and possibly give you tools. And hopefully that will end up helping you. But like Alexandra said, there's really no fixing, because there's nothing wrong with anybody, essentially.
Absolutely. I think you bring up such great points, and it is a really personal thing. It's not at all a reflection on the person if the first therapist that they meet with just isn't the right fit. That's actually a really common part of the process. And it can be really difficult. And I also recognize that there may be barriers to accessing therapy. And so if that is the position of anyone listening to this, I just want to acknowledge that, right? Like there may only be a couple of people who are covered in your insurance plan, or depending on where you're located, even with teletherapy, there can be some limitations. And so trying to kind of find that balance between kind of working on the therapeutic relationship with your provider and, being willing to kind of try again if the first session isn't great. If that's the position that you're in, I understand that. at the same time, if you're feeling disrespected, if you're feeling not heard, nobody should have to put up with that.
Mm-hmm. Exactly. And I think that that might be part of the reason people get scared. Now, on a more positive note, people end this treatment, and you can either end your treatment in one of two ways, and that is end it successfully, or like mine, you end up losing your child. And there's something that's called post-traumatic growth. And the person that introduced it to me is Fabian Bolin, and he is one of the founders of the War on Cancer. So this whole idea of post-traumatic growth, when he was describing it to me, was really amazing. And do you know anything about that?
I do. It's not something I've specialized in, but it's something I've read about to a decent extent. There's a few different dimensions of it. I know there's like kind of a deepening of spiritual connections, or kind of a strengthened faith, strengthened connection to other people, feeling like a greater purpose in life, whether that's your own life or the life of someone else. There's kind of these different elements to it, but it's all kind of centered on finding some kind of meaning in a traumatic experience. And so it is particular, right? That post-traumatic, it's this idea of, I went through something horrible and I am finding something valuable to take out of it. And what's really important is that that can happen regardless of how much pain or sadness or those sort of intrusive traumatic stress memories there may be. I think a lot of people have this idea of it's either or, right? Like either you are overcoming your experience or you are bogged down in it. And I've never been a fan of that way of looking at it. And all of the research that's been done on this has shown that that's not necessarily the case. Post-traumatic growth and stress can really coexist, where it may or may not be that like the more of one that you have, you also have more of the other. So some people may find that they have a lot of post-traumatic stress and that they have a lot of post-traumatic growth. It almost seems like it's like a resource to people who are dealing with this really, really difficult life experience. Mm-hmm. And that's not the way that it is for everyone. But the research that I've read suggests that that may be the way that it is for some people.
But in terms of post-traumatic growth for me, I find wanting to have a complete change in my life in terms of professionally. I started this, and also I'm going to school. Additionally, on top of that, I would say advocacy. And part of advocacy is part of social work and vice versa. And what I've learned is advocacy stems beyond just awareness. What would be your take on advocacy? Like, what is it?
Yeah, it's something that I've tried to define and kind of like put numbers to in some of the research that I've done myself. And casually, I'll say advocacy and activism kind of interchangeably. In my research, I did go with the label activism because advocacy sometimes means like advocating for children with cancer as a whole, which is what I'm interested in. But it often also means like advocating for one's own child. And I wanted to be really specific to sort of the childhood cancer community. And I found that the word activism was a bit more clearer as I was going about my work. So any action that's taken to, one, raise awareness, or two, kind of really concretely change conditions is something that I consider. So it's a pretty wide umbrella. In my most recent research study, we came up with 15 specific actions that we asked parents if they had done. And the most common ones were like sharing information about childhood cancer online, donating money to organizations that help children with cancer, and talking about it with friends. And so those are kind of like the awareness raising activities, right? It's kind of about trying to impact cultural perceptions of what childhood cancer is and why it's so important to change things. And then the least common things that parents had said they did, which were some of the more like involved ones, you could even say some of the more burdensome ones, were like running an organization, whether that's like a charity that raises money or something like you're doing with Living with Scanxiety, as well as like speaking to a crowd. That was something that was relatively less common, where you see kind of like taking on these public roles and taking on like leadership roles. Like when I think of advocacy or activism, I think one of the biggest things that I associate with it is this concept of leadership. Like for me, the most active time in my life when it comes to activism was when I was the leader of an organization on my college campus. And we raised money. We also had free events where students could come and chat with us, and we would tell them about childhood cancer research and why it mattered so much. But I think it's this idea of like very intentionally wanting to make something change. And for me, like the things that satisfied me the most was always the concrete. Like we'd have this annual fundraiser where we'd raise like a set amount of money. I think my senior year, we raised like $2,000, which I've seen fundraisers that raise like 50, 100 times that amount of money. For a college student, it was pretty cool. And I think that where it's like, okay, like we funded, this many hours of research tonight, like these really clear things of like, I can see my impact. That's definitely what always satisfied me the most.
Yeah, that's pretty amazing. And I just want to say thank you for all the information that you provide us with here. And I was wondering, do you have anything else that you'd like to add?
I think just one last closing thought that can be really easy to forget in the thick of it, that I think we can all use reminders of, is that there's no wrong way to respond when you're in a situation that's just not right. But at the end of the day, my biggest goal is not just to help families kind of cope with the experience as it is, but to work with them to change it so that someday in the future, other families don't have to go through such difficult things because their child was diagnosed with cancer.
And I appreciate all the work you're doing. And I know you have your master's now, but I'll definitely be circling back and congratulating you once you graduate. I'll be looking for those papers and they will be up on my Linktree. But just to ask you, in the meantime, how can people get a hold of you? I know you're on Instagram.
I am. And I will say I am like 99% of my way to my master's. I still have to get that diploma, and I will be posting all about it when I do because it's very exciting, just not quite there. But in terms of my Instagram, it is at Alexandra.Neenan, my name. And I can spell that. It's ALEXANDRA.NEENAN.
I am so thankful that you were able to join us and give us all this wealth of knowledge.
Thank you so much for having me. It was a great conversation.
Thank you for tuning in to Living with Scanxiety. Please subscribe to hear more informative discussions like today's. Music is courtesy of Ryan Hamner.